So today what we're planning on doing is the brow lift. Here we're going to redo these eyes or try and improve them, and the face and the neck lift, is that correct?
Yep, that's my understanding. We sort of agreed my eyebrows are in the right place at the moment,
Eyebrows
so we
are
don't want to
gonna-
move them.
The eyebrows are going to stay exactly where they are, we're just going to help get rid of this loose skin here, just to help with the facelift.
Good.
Fantastic. All right, all set?
Okay, yeah, terrific.
So how have you been in the last week?
Reducing gradually in terms of size. It was a bit I felt a bit like a blowfish to start off with. It's gradually getting better and better. You can sort of see every day.
And have you had much pain or discomfort at all?
Not really.
Yeah.
I managed to catch a cold in the middle of this, so that was more of a problem than this was.
Sure.
It was quite a distraction from that point of view.
Excellent.
Things like sneezing were a little bit of an issue, but not difficult.
So we're about 10 days after the operation now. So today what we're going to do is we're going to remove all the stitches and have a look at our preliminary results. It's still going to be quite swollen at the moment, and it's going to be a little bit bruised obviously. But most of that swelling and bruising will dissipate in the next week or so. So at 3 weeks you're going to be quite presentable. But really we assess the results of this type of surgery ideally at around about 3 months after the operation. And by that time most of that swelling will have settled down.
What stage does the numbness start disappearing? Because I can't feel ears and head and things like that.
Yeah, you'll find that. So usually by about 2 to 3 months most of that will return. But you will get some numbness across all the scar wounds, and that will take about 2 or 3 months to gradually return, particularly, and the numbness that you get on the top of the head, that may take 6 to 9 months.
Okay.
That may take 6 to 9 months. Most of that bruising, like I said, will dissipate. It will actually drop down towards your décolletage region and then dissipate from there. We'll just have a look at some of the preliminary results here. So this is just that 10 days. So as I said, there's still a little bit of bruising and swelling obviously, but I think it's looking pretty amazing. The lower eyelids are still a little bit swollen and bruised obviously, but as I said, in the next week or so that's going to dissipate quite nicely. You can already see this mid-face region, like an enormous change really. Just the extra volume that you have in the cheek area here.
Yes.
There's a softening of these nasolabial folds here quite significantly. Beautiful
Big
at the moment. You see the corner of the mouth has come up.
Yeah.
There. You see these heavy set
jowls
here. Nice and smooth now. All looking really good. So that neck that you've really never had. Once again, it's coming really nice and defined neck and jawline here. And the jowl's gone. The creases in the corner of the mouth, the marionette lines have smoothed out nicely. And you can already see here, the ear is in exactly the same position. The earlobe is looking beautiful, but the skin here, the laxity is so much better. So from here, a bit of silicone ointment on once a day. You can wash your hair as normal, be a bit gentle around the wounds. If you're out and about, a bit of sunscreen on. The garment, if you can, try and keep it on at night time. If you have any concerns at all, give me a call. Otherwise, I shall see you in a month's time.
About a month.